You're live.
Good evening. It's 5 o'clock on November 6, 2024, opening Board of Health.
Here's Jillian.
Hi, Jillian. Roll call.
Patrick Tropiano here.
Susan Noy here.
Jillian Morton here.
And Amy Vigant here. Welcome,
Okay.
everybody. We have first, I don't know if I should say last meeting, I'll just so that it's documented, we have a problem that not everybody or nobody that was coming online could get into our meeting. So we're redoing
The public hearing.
the public hearing, but also a lot of people couldn't come on and listen that wanted to, so. So first is discussion and possible vote on 2587 Cranberry Highway variance request.
Yep, and I believe she's here.
He's here in person.
Thank you. Do we have two? So, here we go. I'll share with her. I've looked it over. I'm all set with
Mr. McDonald, would you like
This
to
is the
start?
lead.
You have
I have no comments or concerns. We had a previous conversation. He made some changes to the plans and updated variance requests, so I have no concerns. He's welcome to take it away.
Okay. Would you like to present? Show
Yeah.
your name and
I'm Jack Sargent from Outback Engineering, and we're asking for four variances for 2587 Cranberry Highway. We're asking for reductions from the required setback between the tank and the existing slab from 10 feet to 4 feet, and also septic tank in the existing crawl space from 10 feet to 6 feet. Pretty much just where the existing pipe to the cesspool is coming out, we wouldn't be able to get the 10-foot required distance between that. We're also asking for an increase in the maximum level depth of the system. From 36 inches to 60 inches below finished grade.
Depth of.
It's just the grade of the existing lot.
Cover.
The high point is at the back of the lot,
16 instead of
slopes down to the road, and we wouldn't feasibly be able to grade out, so we would have 3 feet or less between the system and the grade, finished grade. And we're also asking for a reduction from the number of required test pits from 2 to 1.
All right.
It's just the size of the lot, we were really only able to get one test pit in there.
You have the variance list?
It should be in order. I think it's the second or third page in the packet. Should be the second page in. Keep going back.
this is a 3-bedroom.
One page in.
Public hearing.
One page in. Keep going. One more. Oh, keep going. No, you're close. Two more.
I'm getting close. Two more will put me at the top of the list here.
Two,
Okay.
there you go.
All right, there we go. All right, good. Thank you. All right.
This letter is short one variance only because they made changes prior to submitting after I was able to review it real quick. They added the additional variance to the slab. And then they also added the liner that you see in the updated plans. But the list on your plans is correct, it has all
Yeah.
four.
I got it.
Do you have any comments?
No, I don't have I don't have an issue with any of this. It's sort of, it's sort of what you got, what you're gonna do.
Small.
And as far as one hole goes, I don't have any problem with that at all because frankly, we do too many holes, in my opinion. And what it does, it mixes up the soil and makes it harder to put the system in. So I'm quite happy with what's done here.
Anyone else? I would then, if there's no questions, I'd entertain a motion.
Okay, I made a motion that we allow the, five variances? All right, so we're allowing a reduction in the required setback between the proposed septic tank and the existing garage slab. You can see that to 4.3 or 4 feet due to the smaller size of the lot. We don't care about that. We also are allowing a reduction in the number of soil observation deep holes because there was only one done instead of two. And then we're allowing an increase in the maximum allowable depth from 50 to 60 inches. And also
36
from 36 to 50,
60.
yeah, 30 to 60, yeah.
60 below.
36 to 60, and then we're also allowing a setback from the foundation slab. As it says 10 feet, it's supposed to be 20, we're giving a 10-foot separation to that, and a liner is gonna be placed on that side, is that correct?
Could you say that one more time? I'm sorry.
The separation from the slab to the SAS.
So it's supposed to be a 10-foot separation. We're asking for a 4.3.
It'll be slab to the tank.
No, that's for the tank. Is 4'3". So there's only 4 variances? Okay, all right, fine. All right,
And do I have a second?
Second,
And roll call vote?
Patrick Tropiano, yes.
Jillian Morton, yes.
And Amy, do that, yes.
Did you wanna look at that some more?
Thank you very much for coming and thank you.
Okay,
Good
good,
luck.
thank you.
Thank you, everyone. Have a good night.
Yeah, I didn't have a choice.
No,
Really, no
Small.
choice at all. Nice if there was.
Uh, So next, discussion possible vote on Lauren Zachman body art apprentice permit. So we had started this last, what were we doing for various reasons. And it's Elias Gonzalez, he is also here.
Yeah.
Yep.
I see him up there, that's great. And I know you presented, you want to briefly present once more for the record?
Sure. So once I'm cleared here, I'll be able to begin my apprenticeship under Elias as a tattoo artist apprentice. And that apprenticeship would last about 2,400 hours or 2 years, whichever comes first.
Okay.
We have looked at all the paperwork and all of her, what she needs is all here. We had discussed that Elias was somewhat new to the town, but our old regs on body art allow that. And our new regs have not come through yet, we're still working on them, so there's no really discrepancy, problem there. Has anyone had any other questions?
Any questions of Elias? So, Elias, can you hear us? On to talk. Elias?
Hello, yes.
Okay, good. All right. does
Hi
anybody-
Elias, we thank you for coming this week with us. We had last week, we're hoping that always whoever is going to be monitoring the students, that they come, so thank you. And you yourself, was it September? July. Was it July that he first started here in Wareham?
September.
I had put in an application around that time, but I didn't start up until I think maybe a little more than a month ago.
Okay,
Is this your first apprentice?
Yeah.
Great, thank you.
anybody have any other questions? Entertain a motion.
I move that we allow the apprentice permit to Eliza, no, I'm sorry, not Eliza.
Lauren Zachman.
Eliza is already the person. Laura Zagnon, is that how you say it?
Or in Zachnoon, yep.
Oh, that's not too bad. Body art apprentice permit.
And do I have a second?
Second,
And roll call vote,
Patrick Tropiano, yes.
Jillian Morton, yes.
and Amy Vigan, yes. Congratulations, good luck.
Thank you. Thank you so much.
Thank you.
Thank you, Elias.
Thank you.
Thank you for
No
coming.
We have 5 more minutes before the hearing, so you can do whatever you want.
Yep, a few minutes. Why don't we skip to continue discussion, possible vote on tattooing and piercing body art establishment?
Okay,
We have, I spent some time this morning reviewing the last ones that, Ms. McDonald did a great job in doing. There were a couple little issues. Do you wanna present the few
Yeah,
changes?
so we took one last peek through, there was just a couple of minor changes from what you have in your packet, I apologize. If you go through the packet that you have now in the definitions, at some point I must have missed taking out of the definitions the mobile practitioner. Definition. No, we didn't put that into our regulations, so it didn't need to be in there.
okay.
And so we removed those. And in your section for apprenticeship, what I've done is, in the beginning, there's a requirement for you to take a college level anatomy and physiology course,
Page 13, I think,
page 13, I think it is 12 or 13.
12.
So I've reduced that to just the 3 minimums. And the thinking for that is, basically in the current regulations, for your apprentice application, you would have the same qualifications for the people that were doing regular body art and tattooing, so you would be qualified technically. Whereas when you think about an apprentice, they should be learning and gaining skills, so.
Excuse me, it's
absolutely.
page 13, 12, application for body art apprentice that he's referring to.
Thank you.
And the first part, A, says to qualify for apprentice permit, a college level anatomy. Well, these are people that are training, and we've taken out the college level for everybody else anyway. So he's talking about just taking out that whole number 1, because they're in a training mode anyway. They don't need that until they become a full,
So that way, over the course of your apprenticeship, you can be learning your technical skills and the actual physical learning, as well as at that point, then you can seek finding one of your anatomy courses and going through that whole process while you're learning versus, requiring them to basically be certified with all the required technical certifications, same as we would for a regular body art tattooist.
Makes sense.
So somewhere in the second year, we would expect them to do the anatomy?
So they would have to finish all the anatomy and the rest of their certifications before they applied for their full non-apprentice license, because we required to be a full practitioner.
Which makes,
Do the apprentice licenses expire?
They
2 years.
They have to
they have to renew them every year.
Okay, so I would just, I don't know if this ever happens, but if someone's an apprentice and they were just kind of staying as apprentice, is it mostly that wouldn't happen at all? Because then they would never have to do that requirement.
So in the training, it states that it must be at least 1 year, but not last longer than 2 years. So that
Okay.
people can't be there for 4 years still learning, okay?
Right, right.
That's your page 12, number 11.
B,
B1.
Mhm.
So it's a minimum of 1 year, but no longer than 2 years, so they could be up to 2 years.
Okay, good.
and they'd have to have 1,000 hours of supervised observation in that period of time.
okay.
I have a clean copy of it if anybody wants to review it with the changes.
Has there been, anybody else has anything else left that they think that needs to be added or subtracted to these?
I did not find it. I went through with a fine tooth comb one last time. I have nothing else.
Did you come up?
Yeah. No, I mean, the only thing that I thought was really good in here that I'll point out to, we had talked a lot about the college course. And if you look at, on page, was it on page 13? Yes, where's the courses? I'm sorry. It's separated it out for piercing and
I think
tattooing,
it's page 14, actually.
page
It
14.
rolls over on the next page.
Right, so page 14, which is 13E1, so it's E1 and C on page 14. The applicant for a piercing practitioner permit shall provide documentation acceptable that he or she completed a course in anatomy, completed an examination on anatomy, or possesses an equivalent combination of training experience deemed acceptable to the board. So the college course part of it was left out, and that's specifically for piercing. Mr. McDonald stated that he found that there are some courses in anatomy, right?
Yep, there are some standalone courses. The issue with the college level course is anatomy is no longer like a gen ed, it's no longer a 101. So to get to the point where you can take an anatomy course, you would have to go through any
Other
college
courses,
campus's
yeah, right.
general ed, so it could be up to 2 years just to get to that point where you could take it.
And so you will have on file or list in the office of the various anatomy courses that are appropriate that they can take.
You have
Um,
there's a certification from one of them in your packets, actually, I think. Lauren actually took one of them.
And then on part C, the applicant for a piercing practitioner permit shall provide documentation acceptable for that he who completed a course on anatomy. Not just, that's the anatomy one. And then the part D was tattoo practitioner, he who completed a course on skin disease, disorders and conditions, including diabetes. So that's the skin course that we've been talking about. So it's a little bit different. So somebody who's tattooing, the skin course is probably not quite as in-depth, it doesn't have an anatomy. But for those that are piercing and various parts of the body, they have to have the anatomy also. That's the difference. And I think this explains it well, it separates them out, which we didn't have before. So I'm in agreement with that, I just wanted to.
Okay, so we're pretty much ready for this to
Yep.
go forward. Have we run it by council yet? Can we do that? Get it by
Yeah.
council and have
I
them
don't-
look it over?
Not yet.
All right, so if you get it run by council, then we'll set up a public hearing,
Correct.
all right?
Right, with those few last
Do you
changes?
agree?
Yes, I do agree.
Okay,
Um,
so make the corrections.
Yep,
I have a quick question.
Yeah.
yes.
This one is from Florida, I believe. The what's on her certificate.
Mhm.
Does it matter where they do their,
A lot of them are national companies, like if you look, sometimes when you see the Red Cross ones, they'll say New Jersey, or
oh, okay.
it just happens to be wherever the
All right.
corporation is.
So the class may have been local, but
The class is probably online.
certificate counts.
Yeah.
Do we have any requirement with regard to where they take the courses?
Not currently, just because of how limited it is. I think there's only 3 that you can find locally. One of them is this online one. There's one done by, I believe it's the Quincy Board of Health. They do an in-person class. And then there's a third online course you can do. Those are the only 3 I'm aware of that we were able to find.
Thank you.
Great. Thank you. That was a nice job, Ms. McDonald, for all of these. There were a lot of changes there. So next, I'd recommend that we open up the hearing.
Okay, can we, they're gonna take this to council now, right?
Yeah, so that's, next it's
Council
going,
is
it's
on to
being
Richard.
cleaned up,
Okay.
going to council,
All
and then it comes back for the final
Public
vote.
hearing.
We'll do a public
Okay.
hearing, yeah.
Public hearing,
Yep,
yes.
okay, great. Okay, I move we open the public hearing. The Wareham Board of Health will discuss the proposed changes in the town rental regulations. The changes may include but not limited to increase in rental fees and fining for violations related to the annual seasonal residential and commercial rental housing.
Do I have a second?
Second,
Okay,
All those in favor of opening?
Patrick Tropiano, yes?
Jillian Morton, yes.
And Amy Viga, yes.
Okay. You know, we did this once.
We
Without the
did.
people being able to get in, and as it turns out,
No
there's
one's.
nobody here.
There's no one's here.
But it's.
I'm here. I couldn't get in last time.
No, you did.
Oh, that's
right,
right, you weren't
yes.
here, that's right.
And we didn't see that you were emailing us until afterwards.
Yeah, sorry.
So I think the main changes are the pricing.
Why don't we let Patrick,
Yes,
Yeah, so
would you
real
like
quick,
to?
just because
Yes.
Jillian wasn't able to join us.
Yeah.
What it comes down to is we haven't changed the fees for the program in 11 years.
Wow.
Unfortunately, the cost of doing business has increased exponentially as far as union contracts go with raises, and the cost for our contractors has gone up, not exponentially, but a decent amount, as far as their per inspection cost that they charge to us. and we've reached the point where we're gonna be running in the red, unfortunately. So this correction, as well as a future town meeting where we'll change the splits with the town, will kind of right the ship with the program.
All right,
And the changes in the amounts would be?
So the initial change, so the annual fee, the one-time fee for your initial is going from 100 to 125. The additional unit fee is going from 25 to 50, as well as there'll be a re-inspection fee of $50 for, we have habitual issues with people not showing up or forgetting, or they just flat out don't tell their tenants, so nobody's there the day that we show up to do the inspections. And unfortunately, that still has a cost to us, and it becomes a burden at times.
And there's a fee now for hiding from the program.
Correct, as well as an additional late fee and a fee for not registering within 90 days.
It says $250 late fee.
Good.
Yeah. Okay.
You gotta ask. You gotta
And
ask
is, no one's here. Does anybody have any comments,
for or against.
questions?
are those high enough?
They should be. I sat down with the town administrator when we went through the numbers. He's a numbers guy,
Okay.
so I trust him.
Okay,
So is anybody for or against speak for or against the pricing change? Seeing none, I will move that we close the public hearing to deliberate.
second,
And all those in favor?
Patrick Tropiano, yes?
Jillian Morton, yes.
And Amy Began, yes.
Does any of us have anything to say?
So, no, I think it's a good idea.
I think you'll see more turnout when it goes to town meeting.
Okay, so I move the changes that we've made to the rental program.
Do I have a second?
Second,
And roll call vote.
Patrick Tropiano, yes?
Jillian Morton, yes.
And Amy Began, yes.
Okay, thank you.
Thank you. It was easier than last week.
Yeah.
So then we have discussion on Title V regulations
Okay.
regarding
This was
nitrogen.
put on by, Larry and I asked to have this put on because we want to discuss that. But since Larry isn't here tonight, I told him that I'd ask if we could put it off until next meeting.
Was this for generally, so
Yeah, we want to
do,
discuss the nitrogen regulations. There's been a change in some of the way they're handling nitrogen regulations. And DEP's been talking about it, everybody's talking
right,
about it.
correct.
So we want to have some conversation with the board about whether we're doing the right things or how we should do it or whatever.
Perfect. Perfect. And it was,
If that's okay.
so we'll bring it to the next meeting when we have time to add it onto the meeting.
Absolutely.
Great. And with the, so that will be our next regs that we look at. There was, I think, something else we were gonna look at for regs too, but we can start with this then. And switch it out. So health agents report.
Nothing super exciting. I'm lost now, I'm too many pages in. Title V review and variance, we've had one conventional upgrade since our last meeting. We've had 4 upgrade perk tests, no emergency responses. Our restaurant inspections are ongoing as always. We've completed beach water. No pending court cases. Our public health nurse is working diligently doing our disease reporting. Plymouth County preparedness, we just recently did a drill with them. It's one of their call down drills. They put out an incident into the state's web EOC, have us post an update or something just to make sure everybody's current, they can log in and they're paying attention basically. So we're still participating with the coalition and doing our drills. In the rental program, you have the update. We're gonna be updating the fees and hopefully getting the program a little more on track.
And the epidemiologist we had spoken, who works alongside the
Yes.
nurse, she'll be coming one day to talk to us.
Yes, probably beginning of December would be my guess. She's done a very interesting breakdown of, well, the easiest way to say it is the town's health as a whole. She's gone through all of our diseases, all of the common factors that we have for the area and things like that. She'll explain it all, but she's done a full report. And we'll have her in, I think it's gonna be the beginning of December.
Great. Be interesting. Infectious disease or health report, we are seeing a lot of flu. A lot of people aren't, no one's really masking anymore. Would recommend continuing to mask, especially if you're sick or you've been around somebody else who's sick, to protect those next to you.
Especially if you have little kids in school.
Little kids in school, the elderly parents, somebody just had a wedding and everybody, people were sick and everybody comes in sick from the wedding.
My daughter's
So
a-
those are the,
My daughter's a teacher now, so she gets just about everything that comes along, so she's always hiding in her room.
we're still seeing a lot of COVID, RSV. I haven't seen much RSV yet this year, I must say, but I have seen flu already. It's out early this year. So get vaccinated.
Yeah, I was gonna say, a lot of physicals and stuff for the littles, the kiddos happen, and at least the local pediatricians have been great about, there's COVID shots available and there's flu, so you can get those done at the same time.
Mhm.
So,
It's certainly easy to get the flu and COVID at the same time. A lot of people are doing it and not really having a problem.
yeah,
It certainly saves time. Any announcements
I
from
have none.
anyone?
I have none. No? Okay.
Discussion and possible vote on the meeting minutes from October 2nd.
October 2nd, they're in here.
Are we not doing the ones from last?
I move we approve the minutes of October 2nd, 2024.
And
I second.
roll call vote.
Patrick Tropiano, yes.
Jillian Morton, yes.
And Amy Vigan, yes. And so we really didn't have minutes from last week because it wasn't
We
really
will,
live
though.
and all though.
We will have minutes because we actually met and we actually had people in a
Right.
room
So
and
that's why I'm
people
asking.
could ask.
Right.
So there will be minutes.
Okay,
Okay.
so
On today's agenda.
they just want, okay. Thank you. Any other business, anyone?
Move we
This is-
adjourn.
It's the quickest meeting we've ever had.
I know, nice.
Do I have a second?
I move we adjourn.
I second.
All those in favor, roll call.
Patrick Tropiano, yes.
Jillian Morton, yes.
Amy Vigan, yes.
Thank you.
Thank you.
Bye.
Bye. Thank you all. You can